You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have someone from Kansas City, a remarkable, successful doctor. Dr. Gaumer, how are you?
Thank you, Tudor. I'm great. Thank you for having me. How are you?
I'm great. Thank you. It's a pleasure for me to have you on my show. And I'm going to start with a very simple but loaded question. What is success for you?
Wow, that is a loaded question. Actually, it's so many things. Obviously, there's professional success. There's success with seeing your children grow up and be successful. There's, success can be measured with being surrounded by friends. But and I love all of those things, and I think each of them should have a part in what makes someone successful. But since this is kind of more of a professional podcast, I'll say that for me, in my professional career, I think success was always providing a level of care for the patients that I interacted with and my staff and the nurses that I worked with, and having relationships that lifted everybody up. To me, that was success, because that's how my practice grew. And that's how I think in the professional world, you build your reputation and you build, I think the success comes with all of the positive things that you bring to it with how you treat others. And that comes back to you and makes you more successful. I think when you do that, success generally is going to build organically on its own. So the better you treat people, the more that's going to come back to you and make you more successful.
That's a great answer.
Thank you.
And I think you touched on a very important skill, I would say, for someone to be successful. The way you project your success onto your close by people.
Exactly.
Comes back to you probably 10 more times.
Yes. Everybody in the world of, I'm an OB-GYN, board certified. I just retired a few weeks ago from delivering babies. But after 35 years, you learn that if you treat people with kindness and respect and professionalism, they're going to want to work with you. And collaborations occur and partnerships occur. If you are unkind or treat people maybe in an unprofessional manner or belittle them or whatever, nobody's going to want to work with you, and no one's going to want to help you build your business and your reputation and your success. So it's very important.
Absolutely.
Mhm.
So you have your own business.
Correct.
Can you walk us through your journey a little bit shortly?
Yes.
Where did you start? How what brought you to this place, and where are you now?
Well, let's see. I'm going to take you back kind of to the very beginning. So not to kind of give you a super long answer, but I'm Egyptian by heritage, and I was born in Cairo. So I am a first generation immigrant to this country. My mother and father were both physicians. I think every aunt and uncle that I was ever around were physicians. So I think I grew up thinking you grew up and you became a doctor. That there was really no other option. So I always knew I was going to be a doctor. But after medical school, decided to go into OB-GYN, of course, and then started my private practice in a university town about 30 minutes west of Kansas City, and had a very wonderful private practice for about 16 years. And then as my kids were growing up, I decided, that was a little bit more than I wanted to manage as far as time commitment. And I wanted a better work-life balance. So I started a job at a large metropolitan birthing center in Kansas City as an OB-GYN hospitalist. So I did that for about 13 years and just recently retired. But that was wonderful because it allowed me to have more time for my family because once I left my OB-GYN work at the hospital, I could go and do things outside of my OB-GYN world, like start a small business and have more time to travel and spend with my kids and my husband. So that allowed me to kind of go, okay, well, what do I want to do with this newfound time that I now have? And I had started a small medical spa in my private practice. As I was getting older, I was interested in those services, and so were my patients. So started to get trained in the medical spa service line. And then once I became a hospitalist, I started doing some more research into functional medicine and wellness and a little bit more of preventative type medicine rather than standard medicine that is kind of still reactionary where you wait for someone to have an issue and then try to address it. I wanted to see if we could keep patients healthier longer and prevent them from getting disease. I was really interested in that. So I started my initial small business in Lawrence, which was only a medical spa, and did that for about 7 or 8 years, and then kind of pivoted and started a functional medicine business. And when I say functional medicine and wellness, I mean bioidentical hormones for women and men, of course, IV therapies and IM vitamins, hair restoration, sexual function treatments, the whole gamut of wellness care. And then once that was established and up and running for about 8 years, we again brought in the medical spa side of it. So our new med spa has been up and running for a couple of years now and doing very well. So I've been blessed. It's been, I can't say it's been a straightforward, easy road the entire time. There's always, some bumps in the road, but I've been blessed with having a wonderful staff that I truly respect and trust. So when I'm not physically here in the office, I know that they can completely handle what's going on with our patients.
Yeah, absolutely. The team makes the success for most of us.
Absolutely.
Well, speaking of bumps, there would have been my next question anyway.
Yeah. Yeah.
You can be a successful person without having some bumps in the road, even failures sometimes. Can you give us an example of something that didn't work out, you didn't like,
there are so
and
many
you
actually.
learned from it?
Yeah, absolutely. I think sometimes failure, I hate to say failure sometimes is good, but I think it makes you reevaluate things that you're doing and helps you reassess what's important and make better judgments and better decisions down the road. So I have several. I guess one of the big ones is when you start a business, know who your partners are, because sometimes you might think you know who they are, and you might think, oh, these are friends or colleagues, and then things sometimes don't work out when you have partnerships. And so that can become a very stressful situation when a business kind of unravels and partners don't get along. So that was a big lesson that I learned in my first medical spa. And then, sometimes you think you're bringing in a service line or a piece of equipment, and you're really excited about it and think, oh my gosh, we're bringing in the state of the art treatment for whatever service. And then wah, 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 you bring it in and nobody wants it. So you have a piece of equipment or a treatment line that you may have spent some significant amount of money on that is gathering dust and you can't sell it for anything. So do your research and do your homework, which I try to do for any kind of service or treatment that we bring in. But sometimes best intentions, it just doesn't hit with your customers or with your patient base. So, sometimes those are definitely, depending on the amount of money you spent on the piece of equipment you just bought or the laser, it could be a big chunk of change that's sitting gathering dust. But, sometimes you just learn from those things.
Yeah, that's a good point.
Mhm. Yeah.
To be
Unfortunately.
to be as successful as you are right now, going through your profession, your hospitalist career, your OB-GYN career and ending up in something that it's more close to your heart of what you want to help patients with,
Right.
you must have had a lot of skills and habits that had to be uncovered. What do you
Well,
think?
yeah.
Yeah, what do you think it's a skill or habit that doesn't get enough credit for contributing to your success?
You know, it's that's a really good question. For me personally, I have to be hyper organized in my life to be able to accomplish everything I need to accomplish in a day. And that I can probably say is probably the same for any professional woman who's a mother and a wife.
Right.
I always envied my male colleagues because they could concentrate on their work and they would have a wonderful, lovely wife at home taking care of the kids in the house. And I believe me, I have lots of friends who are stay-at-home moms and I love them and adore them. I'm not saying anything about that. But when you are a professional woman, um, you just have to be even that more hyper vigilant and organized because you only have 24 hours in the day, just like everybody else, but you're expected to do so much more. So for me, learning the skills of organization as well as networking with other professionals, as well as other, now that I'm more in the business world, other business professionals, not just medical professionals, that skill was learned because as you know, Tudor, as physicians, we get little to no business training whatsoever. So, yes, you might be an expert in whatever your specialty is and can manage any emergency situation that you're thrown into, but you may not know the first thing about whether it's managing your own practice or if you do have a small business, managing your business, everything from contract negotiations, hiring, firing, payroll, inventory, all the things. So, luckily, I have a wonderful husband who is our finance guru and president of a bank. So he was my rock that I always bounced everything off of. But those were things that I had to learn kind of on the job or pick those traits up to be able to kind of go from my medical brain to my business brain. So that was a lot of on the job training.
Yeah, obviously, for someone like you, and you said it really well, a professional woman is a different type of business person because it has to something has to give at some point. You're a wife, you're a mother, you have to take care of the house, you have to take care of your business, you're a practicing physician,
Mhm.
and it's a lot for 24 hours in a day.
It is.
But it also builds strength and it builds um, character traits that very few people have. And I'm not saying, that the men in your position would do the same, but I feel like a woman has to get more credit for this type of jobs because the society puts so much on your shoulders because of that. And that's why I think people like yourself, successful as you are, have to have some kind of out of the box thinking and mindset. What do you think was the moment that got you over the line to start your own business?
Well, first of all, thank you for that. That is a very huge compliment. I think the push that I had was just in talking it over with some of my close friends as well as my husband who helped me kind of think through the whole business plan and the pro forma and what my vision was and for them saying you got this, you can do this. It was and my mother who's also a physician, I saw her manage so many different parts, the not on her work, her family, her household, her phone call, managing so many different things. And it just gave me the confidence to go, you know what? I saw my mother do it. I think I can do it. I trust myself and I trust my abilities. Um, I trust my ability to make good relationships and to be able to grow because you have to be able to connect to people to grow a business. There's just no other way. If you are going to, first of all, you have to be passionate about whatever business you're going into, of course, number one, but then you have to be able to connect to people. And I felt like in my OB-GYN practice, gosh, I mean, that's about as intimate of a relationship as you can have with all of those mamas coming in pregnant and having a baby. And of course, they're worried and excited and all of that. And I knew that if I could connect with those patients in those stressful situations and gain their trust, that I could do it also in the business world. So I think that was kind of the push that gave me the incentive to go, okay, I think I can do this. But it was not, wasn't a single decision that I made. I really had a lot of support and a lot of people behind me to help me make that decision and feel comfortable about it.
Yeah, I think that's essential also. And you mentioned networking and mentorship, and I think
Yeah.
those two are the most important thing in any kind of business endeavor, especially in medical field.
Absolutely.
Can you give us an example of what kind of mentorship did you pursue, and what kind of networking did you reach out to? Because I'm sure, we're the average of the five people we hang out with, and I'm sure you hang out with awesome people to be able to start something like this.
Well, I tell you, we are a kind of a conglomeration of who we hang out with. I just was blessed to have resources I have a dear friend who's a plastic surgeon who was a great advisor. I have a software developer who sold his business for hundreds of millions of dollars, who was an amazing business advisor. Of course, my husband, who is able to look at all the numbers and spreadsheets and everything and explain them to me, who does not have necessarily that kind of mind. So it was first of all networking with I call them my inner circle, and then after that, it was essentially going and with my training to get trained in some of these things that are not part of OB-GYN, the wellness, holistic health, bioidentical hormones. You'd be amazed that most OB-GYNs, as well as primary care physicians, really don't want to have anything to do with hormone management. It's so maybe outside their comfort zone that they don't really know a whole lot about it. So I had to go and get myself trained beyond what I knew as an OB-GYN physician. So during that training, finding some people that I trusted and felt were experts in their area to kind of develop a relationship with, that I could ask questions of, hey, what do you do in this situation? What have you done about this? Have you had this complication? Have you treated this situation with this type of stem cell or bioidentical hormone or biologic? So you have to develop your trusted circle of people, both in your friend world as well as in your professional world. So you can go to them with questions and don't feel like, oh my gosh, I'm just out here flying by the seat of my pants and I'm, going to try to wing it and hopefully it'll all work out. That's not the way I roll. So if I'm going to do something, I want to make sure it's the best possible service or treatment that I can provide for my patients.
How do you juggle life and business every day? Can you give us an example of a sample of a day for you?
Oh, wow.
What do you do? What
Yeah.
books do you read? What podcasts do you listen to? What conversations do you have? Where do you go?
Yep. Yeah, that's a really interesting question. And honestly, the podcasts and the books that I read are my therapy. That's my downtime, right? So it's never medical. It's never business related. It's never having to do with anything having to do with my crazy business world. That is my zen. So all my podcasts or books that I read either are maybe historical fiction or romance or some type of thriller, suspense that takes me completely away from what's going on in my day-to-day world. But obviously, like all business professionals, I'm sure, you have your routine. You get up, you check your emails, you kick out a few hundred texts and email messages. You meet with your reps that are coming in to, pitch you whatever thing they're trying to sell. So there's a kind of definitely a flow to the day. I try to be as available for my staff in I have two offices, so I travel between the two offices depending on what day of the week it is. So I try to be available to my staff to ask any questions, or if there's a difficult patient, I consult with them and I go in with my staff provider to talk to the patient. Um, and so they know I'm readily available. So I still want to be the face of my business, even though I'm not seeing every single patient anymore like I used to. I still want them to know I'm still here. It's not like I'm in Arizona playing golf and, the staff is taking care of the patients. I still want to be an active participant in my business. So,
Yeah, that's very interesting because a lot of business owners have very big difficulty working on their business
well,
rather than in their business. So that's a distinction that a lot of people don't make.
right.
And it takes a little while, it takes a little time to make that distinction, but it makes a big difference. The moment you
Does.
pull yourself out of your business and you work on it rather than in it, that's where you're financially free.
Exactly. I think you hit the nail on the head. There's no way that I can scale my business if I see every single patient that comes through. I can tell you, Tudor, that with the two offices, we see on average anywhere between 800 to 850 hormone patients a month, as well as about 250 aesthetic patients a month. So as you can imagine, if I was, expecting myself to see every patient, to do every injection, to do every sexual health procedure, there's no way to scale that business, and you're just confined in what you and maybe your nurse practitioner can do. But like you said, when you take yourself out of being the one in your business to the one running the business and not um, kind of muddled in the every day-to-day issue that comes up, you have a much higher chance of success in growing that business, franchising it, having multiple offices, whatever it is that your dream is to do. You're going to be a much higher chance of achieving that goal versus you being in the quagmire of, seeing all your patients every day.
Yeah, which brings me to another question, which is, I think is very important for a lot of medical professionals. Doctors earn a lot of money. We also spend a lot of money, and we get burned out very easily.
Yeah.
And we want to retire, but we do not have most of the time the income that's necessary to survive after we stop practicing.
Mhm.
And you did this with your business right now. But what do you think the importance of having those passive income streams is in a life of a doctor?
Boy, I think right now, especially, it's huge. I mean, w- we I grew up, like I said earlier, I grew up surrounded by doctors in my family, and all of my friends' parents were doctors. I mean, I was literally surrounded in a world of doctors. And back in I'll call it the golden age of medicine, back in the, 50s, 60s, 70s, those doctors made a whole lot more money than we're making now. And they were I hate to say it. I think doctors will always be respected and it will always be a tremendous career, but it's not the way it was then. With it, different insurance payments are going down. So what we're finding is doctors are working harder to make the same or less money. So almost every doctor that I've talked to, and of course in my private practice, as well as being a hospitalist at a big birthing center here in Kansas City, I work with, 40, 50, 60 doctors all the time. And almost across the board, everybody is thinking about, what other services can I bring into my practice to get another, revenue stream, or bring in something else that I don't personally have to be the one doing the procedure, but can be a passive revenue stream coming in. So I think everybody's looking for those different avenues and options. And I can't blame them. I mean, we're working hard, and unfortunately, insurance reimbursements are not what they once were. Or you're having to see, instead of 30 patients a day, now you're trying to see 40 plus patients a day. It's all of those things. So I think it's a big deal. I mean, for me, luckily, like I said, I was married to a banker, so he made sure we had all of our finances in order, regardless of my small business. But I ultimately, I can tell you that my business pays me way more than my work in the hospital,
Yeah, it's
which is
mostly
crazy.
passive.
Yeah,
Yeah, it's mostly
exactly.
passive income rather
Yeah.
than an active trade by time type of
You're
income.
exactly right. Yes,
Yes.
exactly. Mhm.
And I think that's a great point to have, that you built this for yourself at the end of your career,
Yes.
and you made it much more profitable than you were working all those years in a hospital. And
I
that's
know. I wish I knew then what I know now.
well, yeah, that's I was about to ask you, the next question is, if you know what you know right now, what kind of advice would you give to yourself back then?
Mhm. Well, here's what happens when you're newly married. You just started your own practice. You have two little kiddos, and you know maybe a few student loans or something. So you're a little risk averse in taking extra financial risk. And what I would tell my younger self would be, trust yourself. Yes, it might be a bit of a hardship for a short term. Yeah, you may need to go take a little bank loan, but if it looks like a good idea, you believe in it, do it. Even if it might feel a little uncomfortable, or the finances might be a little tight, or you may have to talk your partner into, yes, I think we should do this. Oh, honey, we don't have, it's like, let's do it. Because had I made some of those choices when I was younger, I think we would be significantly even further ahead now. But you kind of talk yourself out of those things when you're younger, and you feel like you can't take that risk.
Yeah, that's a good point. I
Mhm.
think in everything, probably it's more successful to start earlier than you think.
100% in everything. I tell my kids that. My kids now are 30 and 26. And I'm like, start investing, got to start your investments, do this, and they look at me like I'm some crazy woman. And I'm like, you're going to thank me later. I promise you. So they're getting on board, but it's when your kids are 26 and 30, they're not kids anymore. So they can choose whether they want to listen to you or not.
Right.
But they're good kids. So I think they'll follow those directions. I'm pretty sure.
Yeah.
Oh.
What excites you in the near future? What kind of goals, what kind of projects do you have going on?
I tell you, one that I am really excited about is a new mammography machine that's coming out that I think will completely revolutionize the way women have mammograms in the future. And as you know, Tudor, right now we have compression mammogram still. The woman is standing at the mammo machine. The tech is, having to position her breast in the machine and then compression and so forth. As we know, those superimposed images from the mammogram machine sometimes can miss some very small early tumors, especially in dense breasts. So a new mammography technology is coming out where the woman actually lays on the exam table. There is a small opening in the table where the breast hangs into the opening. It allows full exposure from the axilla to the chest wall, and there's no compression whatsoever. So no one's handling her breasts, which makes some women very uncomfortable. There's no compression to cause pain, and pain causes women not to want to go back for their mammograms. So maybe they might choose not to go for a year or two because they maybe remember the pain they had with the last one. And because there's no compression, there's a much higher sensitivity and specificity. So you're having much fewer false negatives and much fewer false positives. So less callbacks causes less anxiety because, women get called back. Oh, we think we may see something here. Can you come back? We're going to do an ultrasound or a follow-up screen. But they can't do that follow-up test maybe for 2 or 3 weeks, depending on the schedule of the mammography unit that they go to. So that woman is anxious for that amount of time going, oh my gosh, what are they going to find? What is it going to be? And so when you are able to have better imaging, no compression, no pain, a very quick scan, all of those are wonderful things, as well as the fewer false positives and false negatives. So this is a self-contained model that has a CT imaging unit underneath the exam table. So it uses CT imaging to provide total 3D imaging for the radiologist to review. I'm super excited about this. As a women's health advocate for obviously 35 years, this is going to save women's lives, and it is going to, I think, be probably the new gold standard in mammography, hopefully very soon.
Yeah, that's amazing. I think this is one of the most important things that need to change in the breast imaging domain, because I think
Yeah.
it's antiquated. We don't have new technology, and I was recently involved in a new startups that I learned about with some new methods, like you said, of technology that comes into your breast imaging. But this seems like a great idea.
Yes,
I'm
this
gonna
was
have to circle back with you and see how you're doing with this
yeah.
new
I am
piece of equipment.
I'm hopefully going to get this machine into my office by the first of the year. The nice thing about this, Tudor, is that it can go in any exam room. So every OB-GYN office can have a diagnostic imaging mammogram in their office. Of course, they're not reading them. The images are being read by a trained radiologist. But imagine, as we were talking about some new revenue streams for physicians, imagine if you had a state-of-the-art mammography unit in your office exam room. You're seeing hundreds of women every day in most OB-GYN practices or private internal medicine or primary care or plastic surgery offices, that you can have your patients just go into the exam room. You have a radiology tech that helps position them and so forth, takes the images, boom, they're off. And you get to charge a little bit of for doing the testing in your office. Radiologist gets to read, so they get a reading fee. They can lease the machine. They don't even have to spend money buying the machine. So we're hoping to be able to place these new mammography units. Really, it doesn't even have to be just in a hospital or a radiology center. It can be in a physician's office. So,
Mhm.
I mean, I find that to be incredibly exciting. And then the patient is in an office that they already know and trust. So it's just another thing that they get done at their
Yeah,
private physician's office.
that's great. Yeah, that's a great combination. How can people reach out to you, learn more about what you're doing?
So they can reach me at Kathy, Kathy, .Gaumer, Gaumer, @gmail.com. And my business is called Regain, REGAIN, Functional Medicine and Aesthetics. And we're in Kansas City, and our URL is ifeelmuchbetter.com.
That's
Love it.
awesome.
I know. And my phone number here at the office is 913-291-8555.
That's great. Kathy, thank you so much for being here. I think the audience will be very excited to get some insights in your practice, and I'm sure they're going to reach out to you for more questions. Thank you so much for being here.
Thank you. It has been my honor and my pleasure to meet with you. I appreciate it. Thank you for having me on.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.